Can anything be done about cervical dish? So dish is a degenerative condition. This is one of those things, there are things in medicine, it's sometimes hard to explain this to people, but there are things in medicine that have been around for over 100 years. Like x-rays have been around since the late 1800s, 1890s, 1895 or so. So, physicians have utilized x-rays for a lot of different things. And one thing about x-rays, there's a condition called ankylosing spondylitis, autoimmune condition where you can get inflammation in the spine and it can cause fusion in the spine. Very serious, requires pretty aggressive medication. On x-ray, you can get confused and think somebody has fusion of their spine from ankylosing spondylitis when in fact they just have wear and tear arthritis. That is called dish. So the radiologists use that term dish to really kind of specifically say there's some calcification going on here, but it's not ankylosing spondylitis, right? So it's a degenerative condition. If it's affecting the neck, then you start with the basics. Physical therapy. If it's not enough, I would recommend talk with a regen med expert who can help out with your cervical spine for prolotherapy or PRP treatment, where you're now injecting either prolotherapy, which is dextrose, or you're injecting PRP, which is your own blood platelets, into the ligaments, the facet joints, and the epidural space to help improve stability, reduce inflammation, reduce pain, improve function, improve overall quality of life. Theano, runner's knee from the age of 16 keeps coming back. Is there a higher risk of arthritis? So you're talking about patellar tendinitis. I think there's probably a little bit higher risk of wear and tear arthritis. But if you have persistent patellar tendinitis, I'm assuming that you've already done something like physical therapy, the right kind of exercises. If that's not enough, you should really be thinking about PRP. And if it's more moderate or significant tendinopathy, then they should be thinking about bone marrow concentrate stem cells. Griffin, degenerative disc disease in the back. Do I think stem cells and PRP can help? Yes. If done appropriately, yes. They can help because they can reduce inflammation in the facet joints that are arthritic, around a nerve that is irritated. They can strengthen the muscles and the ligaments that are weakened in a degenerative spine. Can make a big difference. Kathy, for trigger finger, first and foremost, work with hand therapy. You can use a little bit of a splint to kind of help straighten this out while you're sleeping as well. That can help. If it's not enough, an injection can help. Normally a steroid injection. Now, I've had some good result with PRP in a few patients, but normally a steroid injection will give some degree of pain relief and return of function. If it's really severe and painful and triggering all the time, then surgery can be used. Saris, I'm a professional dancer. I've just been diagnosed with mild arthritis. What does this mean? They mean osteoarthritis, if that's what they mean. Osteoarthritis develops because you've had tremendous strain, leads to a little bit of chronic instability in someone who is high impact, professional athlete, dancer, that is putting constant stress on those joints. You're now starting to develop some breakdown of the cartilage in the bone. I'm sure you do plenty of exercises to maximize your strength in that area. If you have pain, if that's why they've been checking some imaging, you should be thinking about treatments like, for mild arthritis, things like PRP or prolotherapy to help stabilize the joint, to help preserve the joint as much as possible.